Hi, I'm Mayor Ron Nirenberg. Welcome to the Mexican-American Civil Rights Institute Conversation on Public Health. We're living through the most significant public health emergency of our lives, the COVID-19 pandemic. COVID-19 is disproportionately impacting our Mexican-American residents in San Antonio. Economic discrimination and institutional racism are at the roots of the social conditions that make Mexican Americans more vulnerable to COVID-19. We urge everyone to better understand how to prevent the spread of COVID-19, to stay home when you can, and to wear a mask and practice physical distancing when you must be out. This is not our city's first experience with a public health crisis. We will get through this situation with everyone's commitment to protect each other. We're all in this together. Let's stay safe and stay vigilant.
Good evening. My name is Sarah Zenaida Gould, and I am the Interim Executive Director of the Mexican-American Civil Rights Institute. I am pleased to introduce tonight's panelists for a discussion about Mexican-American civil rights and public health, past, present, and future. Tonight, we are joined by three scholars whose work focuses on Latinos and public health. Dr. John Mckiernan-González is the director of the Center for the Study of the Southwest, the Jerome and Catherine Supple Professor of Southwestern Studies, and an associate professor of history at Texas State University. His first book, Fevered Measures, Public Health and Race at the Texas-Mexico Border, 1848 to 1942, treats the multi-ethnic making of a U.S. medical border in the Mexico-Texas borderlands. He co-edited the volume, Precarious Prescriptions, Contested Histories of Race and Health in North America, which examines the contradictions and complexities tying medical history and communities of color together. His broad takes on Latinas and Latinos in U.S. medical history can be found in American Latinos in the Making of the United States and in Keywords in Latino Studies. His next project, Working Conditions, Medical Authority, and Latino Civil Rights, tracks the changing place of medicine in Latina, Latino, Latinx struggles for equality. Born in the US, he grew up in Colombia, Mexico, and the US South, and brings a migrant eye and experience to his projects in public history, medical history, and Latino studies. Dr. Norma Martinez-Rogers is a professor in the School of Nursing at the University of Texas Health San Antonio. She spent the early years of her life in public housing and has spent her entire life in service to the community, first as a teacher in the Edgewood Independent School District and as a caseworker for San Antonio Catholic Family and Children's Services, and then in a career in nursing education. She holds a PhD in Cultural Foundations from the University of Texas at Austin and held 2 postdoctoral fellowships at the Indiana University School of Nursing. She co-founded the nonprofit Martinez Street Women's Center, whose primary purpose is to provide support and educational services to women and female adolescents. And at the University of Texas Health Science Center, she founded Juntos Podemos, a mentorship program for nursing students. In 2006, she was selected to be a fellow in the American Academy of Nursing, which is the highest honor one can achieve in nursing. She is a past president of the National Association of Hispanic Nurses, a founding commissioner of the Medicaid and CHIP Payment and Access Commission, and founder of the International Association of Latino Nurse Faculty. She currently holds a grant to promote, enhance, and provide access to COVID-19 related telehealth technologies. Finally, Dr. Rogelio Sáenz is professor in the Department of Demography at the University of Texas at San Antonio. He is also a policy fellow of the Carsey School of Public Policy at the University of New Hampshire. He has written extensively in the areas of demography, Latinas and Latinos, Race and Ethnic Relations, Inequality, Immigration, Public Policy, Social Justice, and Human Rights. He is co-author of Latinos in the United States, Diversity and Change, as well as Latino Issues, a reference handbook. He is also co-editor of the International Handbook of the Demography of Race and Ethnicity, as well as Latina Latinos in the United States, Changing the Face of America. Dr. Sáenz regularly writes op-ed essays on current demographic, social, racial, economic, and political issues, with his contributions appearing in such newspapers as the Austin American Statesman, the Baltimore Sun, Dallas Morning News, El Paso Times, the Houston Chronicle, the New York Times, and the San Antonio Express News. In 2018, the American Association for Access, Equity, and Diversity presented Sáenz its Cesar Estrada Chavez Award, an honor that recognizes an individual who has demonstrated leadership in support of workers' rights and humanitarian issues. Before we begin, I want to thank our partner, Palo Alto College, for providing the platform to host tonight's event, as well as Bexar County and the City of San Antonio for supporting tonight's program. Finally, I want to share that in tonight's conversation, the alarming increase in domestic violence that has occurred during the pandemic is mentioned. If you or someone you care about is the victim of domestic violence, help is available. I encourage you to call the National Domestic Violence Hotline at 1-800-799-7273. And now for our feature presentation.
Good afternoon. My name is John Mckiernan-González, and I teach history at Texas State University. And I also am the director for the Center for the Southwest Studies. And I'd like to introduce or have Dr. Martinez Rogers introduce herself, and then Dr. Rogelio Lasso introduce themselves. And then I'd like to have a conversation about the things that have persisted around public health and Mexican-American communities in the United States, and the things that have changed and the things that maybe can change for the better for the sort of like holistic and general sense of well-being of Mexican-Americans in the United States. But first, I'd like to pass this over to Dr. Martinez Rogers.
Hi, good afternoon. I am Dr. Norma Martinez Rogers, and I am a professor at UT Health Science Center School of Nursing. And I don't teach, I do have grants. I have a $3 million primary health care grant, of which I have Latino students involved in it who've been very active with Metro Health and in COVID, the screening of COVID-19 patients. And I also have a COVID-19 grant, of which I can talk about later on.
Mm-hmm.
Thank you for giving me the opportunity to be here.
Dr. Rogelio Lasso or Dean?
Rogelio Sáenz. Yeah, so I'm Rogelio Sáenz. I'm a sociologist and demographer. I'm a professor at the University of Texas at San Antonio in the Department of Demography. And I've been doing work on the Latino population and immigration, inequality and demography and so forth. And over the last few months, I've been doing research, keeping trends of the COVID impact on the Latino population, nationally as well as locally.
Now, one of the reasons I do history is that when I worked in public health in Chicago, people kept on telling me like, well, Mexicans are new to Chicago. And I kept on saying like, yeah, new for the last 150 years,
Yeah.
Since 1848. And thinking about public health, and recently people started paying attention to the huge discrepancies in the number of Mexican Americans and the number of Latinos in a state, and the number of deaths, COVID infections, and COVID hospitalizations that Mexican Americans and Latinos face in this country, particularly in Texas. And one of the things that struck me is that Mexican Americans and immigrants have been really visible in these particular health crises as victims of the structure or as threats to the structure of the United States. I know that around the big scares, when the United States to work during the Mexican Revolution or fleeing the Mexican Revolution to survive in the United States, people in the United States were so scared of typhus, even though more people were dying of tuberculosis, more people were dying of typhoid fever, and more people were dying of dysentery and child mortality, that they tried to sort of like close the border to prevent Mexicans from coming, then also dousing them in typhus and vinegar. It's a really good example of how people use medical ideas to discriminate against Mexican Americans. And have you seen that in your work, Dr. Sáenz?
Well, I think you see to a certain extent what we have with the Central American refugees that have been trying to seek asylum here in the United States, and there has been that kind of literally the wall that has been put forth, and for the most part, you have the stranding of Central American and other refugees on the Mexican side of the border. So there you have those kinds of issues as well, and the turning back. And we've had the other situation, of course, has to do with the deportations that have taken place, and people who have the virus here being taken back to their home communities. So you have the U.S. in many respects spreading a virus that people picked up here in our area.
Well, we see, we do have, the School of Nursing does have a refugee clinic. And what we have seen, interestingly enough, is that we have more refugees that are not Mexican than we do Mexican refugees.
Yeah.
And I think that a lot of it has to do with the fear of being sent back to Mexico or their families broken up. And that fear factor of what's going to happen to me is very, very high right now, because if you go, when we do contact investigations, for instance, with COVID-19, what we're finding is that the families aren't answering the questions. Because I almost spoke in Spanish, porque tienen miedo, because they're afraid. They're afraid to say, yes, my grandfather had it, blah, blah, whatever it is, or that we're multi-generational in this house. They're afraid to say anything because they may be living with undocumented. And they're so afraid that they're going to be sent back. And we keep saying, you are going to be treated. But they're not afraid of being treated. They're afraid of that someone will report them.
Yeah, and there have been along those lines, Norma, there have also been the reports that the mass media has been showing of particular communities where there have been outbreaks in the meatpacking communities and so forth, where all of a sudden at stores people avoid anybody that looks Latino or so because of the fear that they have the virus. So that has to do a lot with this kind of the fear factor. In many respects, we know demographically that Latinos have been the fear factor with the changing of the country's demography. But at the same time here, you're talking about then the of exposure with a so-called diseased population and so forth.
Well, you know, and it's in San Antonio. Go ahead. I'm sorry. Go ahead, John.
No, please go ahead. I don't want to get in the way of the conversation.
What I was just going to say is that, you know, like in San Antonio, it's a known factor that in the south side and the west sides have the highest ratio of COVID-19. And that's where so many of our people live.
Exactly, yeah.
I mean, and it's really interesting the way that people who do that kind of discrimination are using visual cues to understand the virus, which of course we can't see. We know it's spread by droplets and contact, but people aren't worried about the contact. They're worried about that other that they can translate their fears into. I mean, a friend just narrated an incident whose son wasn't allowed to go into the public swimming pool because his father works as a nurse. And from other people working construction, they feel that they're discriminated against, not just because they're Latino, but because people think they work construction and that makes them a threat to the particular store. So as our community has a struggle with access, with being treated properly in the workplace, there's another sort of like thing going on of pushing people who look like us in a number of ways, and also don't look like us, look a lot darker than me, being pushed out of public spaces because of medical fears. And I think that's kind of a scary part of public health, the sort of like public and exclusionary dimension of it.
And you know what is, and in public health, what has traditionally been done in public health, and luckily it's changed over the years, but in the past, public health expected the client or the consumer to go to them. They wouldn't reach out. They wouldn't go into the barrios. Of course they do now, you know, but at that time, for so many times they weren't. You know, and our Metro Health is you know, we have the community outreach workers at our Metro Health that reach out to the community, but they have been pulled because the Metro Health needed more contact investigators. So they were pulled off the streets to work with investigating contact investigation when we need them out in the street to talk to the people, to help them get rid of their fears.
So one of the other things, again, I'm a history of the present, even though I used to work in public health, that really strikes me about San Antonio and the work that should be going on in the South Side and should be going on in the West Side is that people have been having this conversation in San Antonio for at least the last 100 years. I think of right after World War II, when antibiotics came out and all these things were being taken care of, the highest rates of tuberculosis in the country were in the South Side and the West Side of San Antonio, and people knew how to prevent tuberculosis. They just didn't go into the community and put those things there. Also, the highest rates of infant mortality in the country were in the South Side and the West Side of San Antonio. And that also then changed and affected the way that people cared about the kinds of public health outreach that they had. That you suddenly had physicians working with PASO, Pan American Spanish-speaking organization, and MAPA to push for better protections for these communities. Do you see this sort of thing happening right now as well? Is the COVID crisis changing the way that the public discussion about politics in the Mexican-American community is happening?
Well, considering that in Texas, we have heard, okay, well, there are only Latinos that are getting it, or only the old that are getting it. If they weren't so fat, they wouldn't get it. If they didn't have diabetes and if they took care of themselves, they wouldn't get it. That's what I see more and more. And I think that it makes people lose faith, not only, of course, in the politician, but in themselves. That, you know, why do it? Why do I go? Who cares?
Yeah, and I agree with that, Norma, the point that you make. We look here at the very much of a minimalist public policy that the state of Texas has with respect to funding of education, extremely low levels of funding, the disparities across school districts. We see it in our own backyard here in San Antonio. The lack of attention to public health, to medical access, the fact that Texas has not extended Medicaid, which has had a tremendous implications that has really exact problem right now with the pre-existing chronic conditions that people have and so forth. With the Latino community, we're talking about 30% of people not having health care insurance. And then we see the massive unemployment that has taken place and people losing their jobs. And for those individuals who were fortunate enough to have health care insurance through their job, all of a sudden they don't have a job. You can't afford the COBRA and so forth. So people are losing their health insurance at the most vulnerable time that you can imagine. And the state of Texas is sitting on its hands, not extending Medicaid to make healthcare available for the population when it needs it tremendously so much right now.
Well, imagine this. Here is San Antonio making world national news on CNN and having the longest lines waiting for people waiting at the food bank.
Yep. Mm-hmm.
It's not because, oh, we're going to do all these things. It's things that are actually happening. We make national news when our Texas, San Antonio, the rates of COVID-19 went up. We made national news.
Yep.
When we look at our school districts, how we are separated, why we have these boundary lines, we make national news.
Mm-hmm.
At how we don't have equity in San Antonio.
Yeah. And the pandemic has completely made that extremely apparent. And people talk about, well, is the pandemic racist because it's killing Latino folks or African American folks? And no, it's taking advantage of the racism that created those inequalities that make people much more vulnerable. And we look at the extent to which you're talking about Latinos dying at a rate 3 times or higher than the Latino population, and particularly here in San Antonio, that it's right now I think it's 3/4 of all cases in San Antonio are Latino, and about 2/3 of the deaths are also Latino.
Yes.
And you're talking about a population, particularly with respect to death, you're talking about a population that is extremely young, and people are really clustered in those age groups where the probability of death is lower, but yet at the same time, we see the tremendous number of people that have died. On the other hand, you look at the white population that is an older population that are clustered in the age groups that are at a higher risk of dying, and extremely low levels of death, and even with respect to the infection rates. So you see a tremendous disparity that is very, very obvious.
Well, for instance, let's think about the first nursing home that in the South Side,
Mm-hmm.
that we had so many victims, so many people died of COVID-19. Staff were sick, patients were sick. Why? Because it was Medicaid.
Mm-hmm.
Had it been insurance, that wouldn't have happened.
Yep.
That would not have happened in San Antonio. Had that been placed in, excuse me for maybe sounding a little radical, but had it been in Alamo Heights, it wouldn't have happened. It would not have happened.
Yep.
I guarantee.
Go ahead. And that's very much consistent with the national kind of trends that a particular study that appeared in the New York Times a couple of months ago that was showing that in nursing homes that were over 20% or more, that were the residents were Latino or African American, there were more likely to be, I don't remember the exact number of times, more likely to be someone infected in those nursing homes compared to where you had whites that were the predominant group in those areas. And you hit it on the spot right now that you're talking about the Medicaid versus the regular insurance and so forth. Yeah, and then the turnover that exists as well, with the pay of people working in those nursing homes and so forth, and the great turnover that exists as well.
But you know, I have to tell you a personal story. I had, about a year ago, I had gotten sick, and when I came out of the hospital, I had to go to rehab. And I went to rehab in Alamo Heights. And luckily I had great insurance. But I will tell you this, that twice, once I was not given my medicines, and I had to call the nurse and say, hey, you didn't give me my medicines. the second time they were giving me the wrong meds, but I knew that I didn't take them because I knew that they were wrong. When my niece came in, little did that my niece is dark complected, and I guess that they thought we only spoke Spanish because we speak a lot of Spanish. When they were going into my room, they overheard the nurses at the nurses station say, "You better be careful because they're Latinos, but they're educated." What do you think?
That's a bumper sticker right there, Dr.
Yeah.
Martinez-Rogers. It's amazing the difference what state you live in. My father-in-law, Korean veteran of the Korean War, had VA care in California. There's Kaiser. He had Kaiser the whole time. The way he was treated in hospitals there and the way he was treated in hospitals here, it was a world of difference. It almost matched equally to the way he was treated in California growing up and the way he was treated in Texas. His family was treated in Texas, which is one of the reasons they didn't come to Texas but went to California, because people had union jobs, people had protections, people had insurance. And then also a lot of the people who were working there, well, maybe they weren't as old as my father-in-law, Sal Cordova, que descansa en paz, but they definitely had feeling and empathy for him because that was kind of created. So one of the things that Dr. Zenaida Gold asked me to talk about is like, what do we need to do to make sure that we can have the kinds of health outcomes and the kind of feeling of belonging that people have in Alamo Heights, that people have in Northwest Heights, that people have in West Austin? What are the kinds of policies we can put together to make a difference in Mexican-American lives?
Mm-hmm.
One word: vote. We have got to teach our people to vote. This is known as a non-voting state. And so they believe that white non-Hispanics, or some politicians believe, that it doesn't matter because we're not going to vote anyway. And somehow or another, we have got to teach our people to vote and learn to advocate for themselves. It is so difficult. I grew up in the housing projects, the Alasan courts, and I'm trying to advocate to not get rid of them because I grew up there. But you know, this is something, you learn this. It's not something that you're born with. You learn it. Somebody planted that seed, and somehow we have to plant that seed in our people and let it grow. As to how are we going to get you to how are we going to get each other, help each other to make the changes that we have the right to have?
And I'll make a couple of points. One is along those lines. I would say the other one with respect to voting, and particularly at the time that we're at right now, is of course with the census and getting counted is the other part, because it's very much related to the distribution of federal funds at a time when we're going to need resources so much to recover from the pandemic, as well as the political representation that we're going to need so that our needs and our priorities are communicated through the redistricting process and so forth, that is, again, is tied to to being counted in the census, and making sure that we elect individuals who are going to be looking after our own particular interests, and that we hold those individuals accountable. Somewhat of what you're talking about as well, Norma. And I think that in terms of the politicians or political leaders, that we elect individuals who are looking at the right to health insurance, the right to education, the right to affordable housing, and so forth, the right to public parks and so forth, that it is not to be maldistributed, unequally distributed across the community, but that everybody has a role to play, and we have that equality as well. And we see that inequality among the native-born population, but particularly the immigrant population that has been completely shut out of any form of assistance. And we know that with the Latino community and immigrants, and the Latino immigrants in particular, have been disproportionately represented among the essential workers, people who have been at the front lines in essential industries and so forth, in agriculture, in grocery stores, distribution of goods and so forth, meat packing, agriculture and so forth. So these are individuals that really have been keeping the country afloat, have been putting food on the table of Americans and so forth. And at the same time, they have been completely stripped of any assistance. And the cruelty that exists in terms of the Congress and so forth is that for those individuals that are spouses, even if they're US citizens, but they have someone who is undocumented, they're not eligible to receive that $1,200 check and so forth. I mean, that is high. You're talking about cruelty at its worst. And we need to make sure that when we're talking about voting, when we're talking about getting counted and so forth, that the politics of this country is extremely broken. It's extremely dysfunctional. And we need to elect political leaders who are going to have that equity lens and that are going to use it to do things rather than to throw things around the words of equity and so forth, but are not put to use in making real change.
Well, you know, and what we're looking at right now is that some politicians seem to think it's okay to have social injustice.
Exactly.
And it doesn't matter to them that if there's no equity.
Yeah, yeah. And here in Texas, I mentioned the minimalist approach to public policy in terms of investment in its population. For long as, if we remember when the government talking about, oh, we created all these jobs here in the state of Texas. Everybody wants to come here to Texas, but it's really very low wage jobs, and they've used having a population with very low levels of education, low benefits, low wages, no unions, and so forth, that attracts many of these jobs into our state, and that does not move people out of poverty. And you have people that are holding 2-3 jobs and trying to make ends meet. So many jobs created, but at the same time, jobs that don't get people out of poverty.
But, you know, and so how do we get our people? Because, you know, when people talk about people of color, they automatically assume that we're talking about African Americans. We are people of color. Mm-hmm. We are part of that people of color.
Yep.
And we have to learn how to advocate for ourselves, because we cannot forget, and we should not let our kids forget, just like the African Americans don't let their kids forget slavery. We should not in Texas let our kids forget what the Texas Rangers did to us. Mm-hmm. What they'd go into towns and hang us.
Yeah.
We forget that in Texas history.
Mm-hmm. And we have
I think another thing, I'm sorry, I'm raising my hand because I respect all of you, even though I'm supposed to be moderating. I'm so sorry. I think another thing that we forget is that Mexican Americans have organized successfully, have made a difference. Like if you look at the change in infant mortality between 1950 and 1980, in 1950, San Antonio had the worst infant mortality rate in the country. People pushing for paved sidewalks, people pushing for sanitation, for sewage, people pushing for food in the schools being provided. Those are the kinds of basic public things that Dr. Sáenz was talking about that made a huge difference in people's life outcomes. It's the social wage that's paid through taxes, that's paid through revenues that need to be fought for. And I think voting is also, like, we need to learn that voting is the beginning of the conversation, not the end of the conversation.
Exactly.
That you vote and then you ask people to follow up on the vote. You ask for other things. You keep on asking until they know what it is that you want. And I think a lot of organized around public health, a lot of people asking for the opportunity to go into hospital and not die because you're mistreated in these things is part of public health, of going into hospital and being treated, even though you're gay, even though you have HIV, being treated like everyone else. These are all sort of like fights that all of us need to feel that we're involved in and are affected by. And I think this is something that you teach your students in, this is something that you teach at in your school. And I think this is something that Dr. Sáenz does too. It's like thinking about the structures. Who is responsible for these outcomes? And what can we do, all of us, not just Mexican Americans, to change these outcomes, because we're all affected by them. I think that's one of the things that COVID-19 has done, is shown how connected we are in terms of how disease is transmitted, but also how connected we are in terms of, like, if people are too scared to work, the economy is going to collapse.
Well, I remember when COPS was, do you remember, y'all remember COPS? COPS in San Antonio was extremely, I was a member of COPS years ago, and boy, we were a voice. And you know, the thing is that it's our younger generation really is who needs to take over. As I see, I'm proud of the people that protested, that walked the streets, because it was a mixture. It wasn't just African Americans. There were Latinos also. There were white non-Hispanics after George Floyd died. So, you know, I think that we're heading in the way of, but we need to also remember about healthcare, which is so vital.
And I think that as we see the transition from the Chicano movement leaders and so forth and others to the newer generation, and it's a very full time. I think there you see starting with the Dreamers and the push that they made to try to get legalization path, not only for themselves, which they had more sympathy from the mainstream, but they were also pushing for their own particular relatives and so forth that were not eligible for DACA and things like that. And that fight continues. And I think that you see it here in San Antonio, and you see it of the youth all over the country that are at the forefront in terms of organizing for voting registration here in San Antonio, TOP and others, the Mi Familia Vota, these very useful groups. And I think here with the marches, the protests following the killing of George Floyd, it also shows the young people, and not only Latinos, but African Americans and others that seem to be a very hopeful sign, and people that are very upset, very mad, and so forth. And this is the kind of fire that is needed to try to be able to push for greater change. We see it here in the city of San Antonio, where the youth were very much letting the city council know what they wanted. And one of the things that they were saying, we're going to defund police, put it in more constructive ways, dealing with mental health, dealing with housing issues, all these other issues that create this crime. We saw it with the mass incarceration and things like that. And city council seemed to say, oh yeah, we hear you. And then they turn around and give $8 million more in funding for the police.
They had to do it.
Oh, in their defense, they might have said only 8 million more.
Only, yeah.
What's really interesting to me is when you get involved in a movement, you also get to find out how other people share your situation and learn different strategies about how to change their situation. So I'd like to have a very selfish question for Dr. Sáenz. I wonder if you could tell us a little bit about the article and the research you're doing on the uncounted deaths that you've seen as affected by COVID-19. I just read a review of the article, but I think it's really important because it reflects sort of like the conversations we have about people dying and getting COVID, and then those deaths not necessarily getting counted. So I was wondering if you could speak a little bit about the methods you use to get to that conclusion.
Exactly. So kind of a little bit of a background. Early on, we're talking about March. By late March, it was very obvious that the COVID was really impacting African Americans and the Latino community. And we saw that mass media was really doing a good job in terms of showing the people that were catching the virus and that were dying from it and so forth. But at the same time, there was very, very little data on that. The first information that sent me in a particular direction was Black Lives Matter had put together a data set that showed, at that time, we're talking about early April, there were about 8 states around the country that were providing data on by race. So I was able to go into those links and start pulling the data together. And at that particular time, it was extremely, extremely messy. The data were, and in particular, the old problem with the census that always exists, whether the Latinos are an ethnic group, not a race group, so that in many states, and even when more states were making the data available, you would be able to determine how many Latinos were catching the virus as dying from it, but you could not compare them to whites, because in many states they were double counting. If whites, Latinos that were identifying racially as white, they were also counted with whites, which suggested that whites were dying at higher rates, but it was simply because of the Latino whites that were being counted in that category. And then, so I had been doing a monthly, I've been doing a monthly blog for Latino decisions, where I've been keeping track of the trends that are going on. And I think it was a couple of months ago, where we were beginning to see the spikes in Texas, as well as in Arizona and in Florida. And the data were showing that Texas Latinos weren't doing all that terribly bad compared to other states. And they were, scratch your head, because it doesn't seem that way. And then, but it became particularly apparent when the South and the West, where people were being sent back to work, and all of a sudden we're seeing those spikes. And the data analyzing was showing that in California, in Arizona, in Florida, and other parts of the West, the South, you were picking that up, but not in Texas. Texas seemed to be pretty stable, and this was consistent with an analysis also that was reported in the New York Times that was looking at areas where you have major racial disparities in COVID, and Texas was completely in gray, which indicated that race data wasn't available and so forth. And then so I started looking at the data more carefully, and it showed that in Texas, for example, something at that time, we're talking about late June, about 75% of deaths had not been processed yet, or did not have Latino and race information. Wow. And about 93%, and it seems like I'm exaggerating, but about 93% of cases didn't. And then I went to the state dashboard, and there were two at the beginning. You saw the actual number of cases, which is itself an underrepresentation, and the number of deaths. And then you go to the ethnic and race, and then you see the number of cases. It's a very minor drop in the bucket compared to all the deaths. And then this, in the last month or so, you've seen that they've done a much better job with respect to death. Now it's something like 99% of deaths are accounted for, supposedly. But still, with the cases, it's 93% or so that are still unaccounted for. So that here, it hides the disparities that exist, and we see tremendous disparities with the limited data that we have. But as long as states are not reporting those figures, and there's still about 5 or 6 states around the country. Hawaii is one of them. I can't remember the others right offhand. One of the Dakotas, I think South Dakota, and 3 other states that aren't reporting data by race. And you can see the tremendous kind of information that is not there for us to analyze and really make sense of this. One of these states, Nebraska, only I think in the last couple of months has released data on by race and Latinos, and we know that Nebraska was one of those states where we had the outbreaks from the meatpacking industries and so forth. So as long as those data continue to not be out there for us to really understand the disparities, and here in Texas, we're talking about a major state, the second largest states with respect to Latino population, and the data are so limited compared to California, compared to states around the country that have done a much better job of getting that information out.
But don't you think it's done on purpose?
Oh yeah, yeah. In my op-ed that Poynter Institute had invited me to write on this, and I had said something like politics in Texas, politics, a question mark, and I said nah, with an ironic twist. Yeah.
Dr. Martinez-Rogers, I was wondering if you could speak about the COVID-19 grant that you're doing and the kinds of efforts that you're helping to manage in Metro San Antonio.
Well, I got a COVID-19 grant to to buy equipment to do telehealth. And what we had proposed was that we wanted to do telehealth with our senior citizens in particular, but we also wanted to do with families who had foster children. And because we have our Wellness 360, which is our clinic, we have people involved with both the senior citizens and the foster children. And what I wanted to buy equipment so senior citizens, we could teach them how to take their own blood pressure, how to take their own oxygen level, how to take their temperature. And interestingly enough, Health and Human Services gave us this money, but would not let us buy equipment, only the computers. They wouldn't let us buy any equipment to distribute to the elderly. So what we are doing now is because of social isolation, and most senior citizens have a phone that we can connect with them. We're setting up a system. We have a big meeting next week to set up a system where we can connect with them. And what we're doing is we're going to actually assign students that are going to be like, not their pen pal, but their voice, just to have someone call them and say, how are you doing? Is there anything that you need? How can I help you? Just to be like a comadre to them, respectfully. But that's what we're going to do with the equipment that we buy, because what we initially wanted to do, Health and Human Services said, no, they don't need that equipment. Well, they keep saying that you need to check your temperature, but they didn't need it. So we're going to set it up that way. And for the foster parents, what we're doing with them is also working with them in terms, because students were at home, the kids were at home. And foster children sometimes are not the easiest children to handle. And so I don't want to label them, but sometimes they come from very broken homes, and some of them may have some behavioral problems. So we were using telehealth to help them better be able to handle the children. Plus we're using it for mental health. All the equipment that we got, because that is the one thing that we do have is a lot of depression. And that's one thing that we're able to screen our senior citizens with. It's one thing to be socially isolated, but it's two things that we're finding is that they get depressed, and those that drink seem to drink more than they usually do. So we're trying to work with them from that perspective. But it's only a year grant. They only give us a year grant, and it's mostly to do communication with telehealth with the patients, which is the way that it's going to be. You know, if you have a problem, we don't want you to go see someone. We want you to work with us through telehealth. And you know, one thing is that I did find it interesting, and I just wanted to bring this point up when Rogelio was talking, is about when we first started screening and testing here in San Antonio. Do y'all recall that it was done at the Coliseum, the Freeman Coliseum? Mm-hmm. Well, what happened with that is that the people that were really sick couldn't get there because they were too sick and they didn't have transportation. And who was going to take them? And those that did go get tested, and this is true, is that in the Latino family, if say that the father wasn't feeling well or the mother wasn't feeling well, the whole family would go. So they were all being exposed to it because we had not done enough education. And one thing we are going to do with the telehealth is to do more education and to put it out there and to do it bilingually. And I'm not talking about we're talking about in the language that people understand, in the simple words. I mean, we ourselves go to doctors and when we leave, we say, if only I had asked this question. So we're going to try to help them in that way. Social isolation is a big problem right now that we have with our senior citizens.
One of the things that sort of like is tragic about this is that one of the best ways to make sure you get treated properly in a hospital is that if you're sick, your family's there to make sure that the nurses and the doctors watch over you. Yeah. It's good politics. It's good strategy to have people out there making sure people are paying attention to you. And with COVID, that is something that is, you know, seen as a health risk rather than a good cultural strategy for survival in a hostile medical establishment.
Well,
sorry,
go ahead. In public health, the biggest threats that public health has right now are disparities in healthcare and access and outcomes, you know, that they're not able to get healthcare. The second one is social isolation, but the third one is also violence. There's a lot of domestic violence right now, child abuse and domestic violence. Those are the three key areas right now of public health.
And we've seen the last month or so that the reports coming out with the increase in shootings and murders and so forth in the larger community as well. Yeah.
One of the things that's really moving to me as a historian about your work, Dr. Sáenz, and your work as well, Dr. Martinez-Rogers, is highlighting the sort of like public dimensions of Mexican American and Latino situations in this country. The way that depression connects to a general social isolation and abandonment. The way that depression connects to a larger story of not being part of the United States and not feeling connected to the larger story, but also the ways that no health insurance through your employer, paying too much of your income for rent means living multi-generationally, means being exposed to COVID-19. Working low-wage jobs means less union protection, less authority in the workplace, less ability to stand up to people who are endangering your health in a number of ways. But particularly thinking about the way that if you improve the conditions that Latino families, Mexican American students face in public schools, people face at work, you don't just change conditions for Mexican Americans, you change conditions for everyone in the society around them. You can't make a structural difference for Mexican American families without changing the conditions for other people. I particularly like the work that Dr. Sáenz, you've done around schools and Latino youth and the way that public education is a Latino issue, but Latino public education is also a Texas-wide issue. And I think it's really important when we think about Mexican American categories to think about how it's connected to the inequities of this country, as well as sort of like possibilities that are created here. And I looked up a declaration in 1978 from the World Health Organization about what public health is. And the conference, this is from Alma Ata, strongly affirms that health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, is a fundamental human right, and the attainment of the highest possible level of health is a most important worldwide social goal whose realization requires the action of many other social and economic sectors in addition to the health sector. So public health isn't just public health. Mm-hmm. And I think this is something that the women who were part of the strike in 1952 in Silver said, we want sanitation, not discrimination. And I think this is an underlying thread, please correct me if I'm wrong, of this conversation that we've had right here. Do you agree?
I think you have the whole thing is intersected in so many respects where you're talking about, and very clearly you highlighted that the way the job that you have, the level of education, the access to healthcare, they're all extremely, they're all interconnected with each other. And I think that represents the other idea is the interconnection of people across neighborhoods, across communities, across the state and so forth, that my health depends on how you're going to, if you're going to wear a mask or so, that is going to protect me, but is also going to protect you, that we have this this interconnection that is clearly the case. And back to the point that you were making, John, with respect to kind of the bigger picture and Latinos and that you have to change for everybody, not only for Latinos. But one of the things that we see with the inequalities and so forth is looking at the disproportionality and so forth, the extent to which you're talking about a population here in the state of Texas. There were 40% of the state's population, but yet if you look at the younger population, with youth and so forth, we're the majority already and so forth. So that in many respects, when you're talking about looking at the future of Texas and looking at the sustainability of the state with respect to jobs, with respect to income and so forth, that's going to be disproportionately driven by the Latino population and so forth. So it's incumbent upon the leadership, which has neglected us tremendously for ever since the state has existed, in terms of building that human capital, human resources, and so forth. The next generation and so forth that is disproportionately Latino, but also African American, also Asian, also white, and so forth. But the point is that there has to be the investment in the well-being and the preparation, the education of the next generation and so forth.
I fully agree with you, Rogelio. In my grant that I have, the larger grant that I have, which is on primary care, is that I actually have students and what nursing students, when they graduate, nurses, when they graduate, want to go work in a hospital. Mm-hmm. But in my grant, it's all community-based. When you get in my grant, I'm going to teach you how to work out in the community and be grassroots nurse. So this is the second cohort that I have that will be graduating in December. And all of them that have graduated from my program have now gone back out and worked in the community as primary care, what we call primary care nurses. They're all bilingual. And one thing I do pay for their tuition, their insurance, their books, anything that they need while they're in school, plus give them $1,000 a month stipend. It's a huge grant, but it's the only way that I think we have to teach our young student nurses, in particular the Latinos, that, you know, it would be great for you to go back out into the community and work with grassroots, because that's really where it happens. These students I just had them write their thoughts and their feelings. I haven't keep a journal, but they wrote it, their thoughts and feelings about being in this program and what COVID-19 did for them. to them and with their about their families, the communities that they live in, because many of them, one of them, her parents were laid off, they're undocumented, and but you know, she has a great story. She talks about how she's getting through it and how it's worth it to her to work out in the community. And that's really what we need to do. We need to teach our students how to be grassroots.
Mhm. And the great need that there is for the healthcare workers and so forth in our community. So that you're preparing the workforce, that you're really opening up and making the connection to the community,
Exactly.
and then the world of information and so forth, and advocacy and so forth, that they then can distribute to their own families, their own neighbors, and things like that. That's really great stuff.
And I'm just going to say this as a professor, and nurses make more money than professors sometimes. Like where you work in the community or work in hospitals, it's a more lucrative career than being a faculty member. And I think people also forget that. I mean, you can do good and do well in many ways.
And that's why we can't get Latinos to come be faculty.
Now, one of the things that's also important is, I guess right now there's a lot of conversation about what word we should use to describe our many communities and our many situations, our many identities. But I was just wondering if we could sort of like talk a little bit about gender and public health. I worked in HIV, so my big sort of like gender and public health issue was, well, my two big issues. One was sort of like being able to come out safely at work, keep your health insurance, be treated as a person if you were gay and employed. But also the other issue was if you were married to someone, it was really hard to get people to talk about their sexual contact. So there's a lot of silence in there. So gender affected both sort of like people's family situations and people's ability to have equality at work. And that's, of course, really marks me as an old, because that was maybe 40 years ago. Okay, not 40 years ago, 25 years ago. But how do you see gender affecting sort of like the way that sort of like inequality rains down along gender lines affects sort of like Mexican American communities and Mexican American health outcomes?
Well, I think that I think it depends. You know, I still think that there's a lot of non-acceptance of, you know, the LGBTQ community, and I think it's perhaps more tolerated, but not necessarily accepted. In some cases, I mean, that's a hard question because.
Mm-hmm.
I mean, I see in my own family, my own nieces that are all that are in college, they don't have a problem with it. I mean, you know, the millennials, okay. You know, I don't see I think it's more the older generation. I don't know. I mean, that's kind of what I think. I don't know. Rogelio, what do you think, or what do you see?
I think that to a certain extent, I think that you have the generational kind of changes that are taking place, but I think that still there is the level of intolerance still even among the young. I think that for the LGBT community, I think, and we see, I think, around the country where there have been the beatings of people and transsexuals and so forth. So that's a very, very difficult situation, particularly if people feel that they don't have that family support and the trust that they need. Along gender lines, I think that we also face some of those issues having to do with the treatment of sons and daughters and so forth, and that we still see that inequality take place. But one of the major changes that is taking place has to do with our females, Latinas, are much more likely to be graduating from high school, for example, at higher rates, much more likely to go on to college and so forth. So that in many respects, we're talking a generation or two ago where more women were forced to stay in an abusive kind of relationship because you had the economic dependence on the husband and so forth. As you have Latinas then becoming much more independent and so forth, you see that they don't tolerate that. So that's a very positive move that we see. And we see also another very favorable trend has to do with, if you look at the political ideology of males, Latino males and Latina females, there is a major difference where you see the progressive politics, much more questioning, much more, again, progressive kind of politics and pushing for that more equitable kind of agenda. It's women who are at the forefront of that. And I think that if Texas becomes, when Texas becomes a blue state, it's going to be Latinas are going to be there at that forefront, that they're going to be making those changes much more than Latino males. And we see, for example, when Trump ran for president, he, particularly here in Texas, he got about 35% of the Latino vote or so. And I suspect, and there was along gender lines as well, that Latino men were more likely than Latina women to vote for Trump and so forth. So those are some of the shifts I think that we're seeing.
Interestingly, though, in nursing, it's a little different because what we have seen is that the Latinos who come in, males who come in to be nurses, that what we have heard from well, I've heard it from some of my students that are in my project, that their fathers are furious that they chose nursing, furious with them. And when they're studying, their fathers make a lot of noise at home and cause all kinds of problems. But we also see this with some of our younger Latina students who have had the same boyfriend since junior high school. The guy graduated but went on to be a construction worker, whatever. That there is what we have seen is that prior to an exam, there are fights in the home. We have had students have been physically abused as they get closer to graduating. And we do see this, you know, nurses tend to be caretakers and they tend to forgive very quickly. And even though we tell them, hey, you know, you need a safe place to stay, let's go. And we refer them to all the correct places. It's very difficult to break that cycle, especially when they've been dating the same guy since junior high or high school.
So in this conversation, we've discussed both how continuously Mexican Americans and Latinos have not had access to the same kind of healthcare, have been exposed to more diseases, have had the afflictions that face them treated invisibly or disposably, are expected to be essential workers as farm workers, construction workers, restaurant workers, custodians, but are not given the kinds of protections that people do. And it seems like a really stark situation. And I was wondering if, when you look back through your work and you look back through your research, do you see places where the health situation and the social situation has changed for Mexican American men and Mexican American women in terms of all the ways and things that affect what we call health and well-being?
I've seen a few changes, you know, that I have seen that in particular with the women, the Latinas, wanting to get more educated about their own health, you know, and they're usually, or the Latina woman, the Latina is usually the one who's in charge of the family in terms of even their health. And I've seen a little bit of that change. What I don't see is that we have improved to the degree in terms of taking care of the health disparities of the underserved population. And that I still see that our Latinos still struggle with access to care. And that's a big big issue. And at some point, we have got to realize that our patients don't need to come to us. We need to go to them. And that somehow or another, we need to set up, you know, when Metro Health got rid of all their clinics and University Hospital took them over, and then they got rid of all their registered nurses, that is a problem.
And then with respect to some of the changes, I think one of the major changes has been, and John, you brought this up with respect to the change in the infant mortality over time, talking 1950s, 1930s, all the way to 1980 and so forth. And that has been that with respect to the longevity of the Latino population and the death rates, that it is what epidemiologists call the Latino epidemiological paradox, and that is that despite not having access to healthcare, working and more likely to be working in more dangerous jobs, more likely to have lower levels of education, higher levels of poverty and so forth, yet Latinos live longer than whites, which is a paradox. And that is one where you see the infant mortality rates that have really come tremendously down. Still high, but they're relatively similar, or in some cases lower than those of whites, and we're living 3-4 years longer, even though we do so with greater degrees of disabilities, greater degrees of chronic diseases, and so forth. So those are some of the changes, and I think that in many respects, those have been due to social support, social networks, and the extent to which family has helped people deal better, particularly, and the paradox is particularly apparent with the immigrant populations that come with particular kinds of cultures that are more immigrant-related cultures. The foods that they eat and so forth are healthier foods. They're more likely to be active and so forth. And the research has shown that the longer they are here, that they lose that advantage that the immigrant life provides. And I think that as we see a significant decline in immigration, particularly immigration from Mexico to the United States, I think that some of those safeguards that existed with respect to longevity and so forth, that we're going to lose that as we have fewer and fewer immigrants that are coming, that are bringing those values, las ganas and so forth, that they pass on to their kids and so forth, that those are going to be lost, as well as that familism that continues to be very strong, particularly with the immigrant population.
Yeah, 10% of Latinos are reported to have fair or poor health conditions. And about 21% of us have diabetes.
Yeah. Mm-hmm.
And over the age of 20.
Yeah.
And in Hispanic women, 40% of us are more likely to have cervical cancer than any other. Mm-hmm. So those are still high rates, and we still continue to be the most uninsured population.
Yeah.
And I just want to sort of like follow up on that comment. Is it also the rise in cervical cancer rates, the rise in diabetes have also accompanied changes in the possibilities and the conditions of neighborhoods? Like the rougher there are, this is like a really good example that it's not genetic, it's historical. It's right. Policies that make these things happen.
Climate.
And I want to go back to policies and to San Antonio. Like when you look nationally and you look at things and organizations made difference, COPS has made a huge difference to the conditions in South Side and West Side of San Antonio. And I don't think community organizations and civil rights movements have been given the kind of credit that they deserve for Medicaid, Medicare, and all the other things that make life better for Latino and Mexican American communities. So, want to make a difference? Join an organization, fight, vote.
Exactly.
There you go.
Amen to that.
Hello, Thank you so much for joining us tonight. My name is Sarah Gould. I'm with the Mexican American Civil Rights Institute. And once again, I want to thank Palo Alto for co-hosting tonight's event. I think that if Dr. Mckiernan-González is ready, we do have some questions in the question box. There is a question about, so the city has discussed $8 million to fund something, but the question was, how can you imagine money like that going to public health efforts, and where would it most be needed?
Okay, so we're talking about okay, go ahead, John.
I don't live in San Antonio, so I'm gonna pass.
Oh, okay.
Well, I live in San Antonio, and this is Dr. Martinez Rogers, and I would say that some of that money needs to update our Metro Health, and that when we look for a director of our executive director of our Metro Health, we need to find someone that is a Latina or Latino, and we need to have someone that understands the population in San Antonio and in Bexar County, and understands the underserved population and the health disparities that we see, because in the past few times we have not had anyone in a key position of executive director be a Latino, and that needs to happen.
Yeah, I agree. There's a tremendous need for the leadership coming from the Latino community. I think that we see the disconnection right at this time with the pandemic, where COVID is really disproportionately affecting Latinos, and we need that particular voice and the connection to the community. At the same time, there are also a lot of other very significant needs in the Latino community and in the larger community of color, having to do with affordable housing is a major issue right now. We know that this was a major issue as gentrification was taking place, but particularly now where we have people that are being uprooted from their homes and so forth because they can't afford to pay their rents, or losing their homes because of the mortgage. And the access to health, we see right now the outcomes of those disparities of access to health, and the Latino community and the African American community are paying the price of those disparities that exist. And we need to really take seriously, for example, the council has been talking about having an equity lens and so forth, and looking at all issues along those lines. And there was a resolution also it is a crime. Racism is a public health issue, and that had been passed. The resolution has been passed, but now we need to put teeth behind it and really make policies that are going to address these kind of disparities, because we know the outcomes of racism exist at two levels. One, at the individual level, where you have what the Black Lives Matter has shown us tremendously right now, is that you can never relax when you're a person of color, and you go into a food store, you go into a restaurant, you're walking down the street, and you're automatically at risk of being stopped, frisked, whatever, which led to massive incarceration and so forth. And not only does it put us in harm's way, but it also affects our health. You have this constant pounding that you can't relax, the impact that has on high blood pressure, a variety of other diseases, heart disease and so forth, that we pay the price. And again, more structurally in terms of the neighborhoods that we live, where Latinos, African Americans, and the poor are more likely to be disconnected from opportunities, disconnected from parks, disconnected from libraries and so forth, that impact how well we do and so forth. And we know that people of color are more likely also to live in areas where you have pollution, what's the word that I'm looking for, the wastes and so forth that that affect our health throughout the country. There are these links to cancer prevalence and so forth, and it's all these things are put in communities of color rather than in the Alamo Heights. That was a Freudian slip. Alamo Heights, and these disparities need to be eliminated. And again, when we're talking about an equity lens and the resolution that we need to, that racism is a public health issue, now we need to put teeth behind those decisions.
I think that if I might say, I'm going to quickly say this because I do have to get off in about 3 minutes. This is Dr. Martinez-Rogers, and that is that as we vote, which is so important, you know, in voting, and I know we don't have a county commissioner's election coming on anytime soon. However, I do want everyone to keep in mind that all our county commissioners are men. And at some point we need to get women in there, and because women think differently than men, as we all know, not that it's better or worse, but we do have to have some female representation if you want to talk about gender. That is one thing, because we have been predominantly driven by men as county commissioners.
Completely agree.
I also see a question here about how can we advocate and support the needs of the Black population while we're organizing for advocacy and support for our own communities too.
And I think in many respects, the issues, we have similar kinds of issues having to do with education, having to do with housing, having to do with access to a variety of resources and so forth. And one of the things that that has been very important and that is often forgotten is that that research has clearly shown that in the African American community, there's a high level of support for immigration and immigrants, people who are here as undocumented immigrants. So you see that African Americans have already made that inroads into the Latino community, particularly when it comes to immigration. And in some respects, we see even higher levels of support than we find in certain segments of our own Latino community when it comes to immigration. So that in many respects, I think that if the two communities come together, that there is that commonality that can be a stronger force for pushing for the betterment of each of our communities, which we need to overcome because the mass media and the white power structure and so forth, and employers and so forth, always put those seeds of disconnection that they create, the conflicts where we're fighting among the little mirmajas that exist and things like that, that we need those connections to be made more effectively.
I guess as the other panelists, sorry, I was seeing Fernando Salas on here, apologize. I would agree. I mean, I think it would behoove community organizations or organizing Latino communities to expand the circle of the communities they're trying to organize with, that it would benefit people to try to work with different community organizations, especially community organizations that work, as Dr. Sáenz pointed out, on issues of access, issues of participation, issues of structural vulnerability. And you don't want to be the person at a hearing that's arguing for issues of structural vulnerability and not be in contact with other organizations that are organizing around issues of structural vulnerability. You want to create a conversation and a culture that emphasizes challenges to where toxic waste dumps are being put, where community clinics are being put, where freeways are being built, where new schools are being built and where other schools are not being built. You don't want to be the fool who's out there on their own, not talking to other people, not doing that. So in terms of organizing to make situations better for everyone in, let's say, your zip code or your city or your state, you know, be very aware that it is in your own best interest to expand the people who are organizing on issues that affect you and affect other communities. You're muted, Dr. Gould.
I'm so sorry. There we go. Okay, one day we'll figure this out. We have another question about, let's see, I think I want to go to this one. Research shows that Latina women are often the procurers of social services. So what are some strategies that you would recommend for better empowering Latinas as they work to support their families and politically organize?
I think the political organization is a major vehicle, and we see it here in San Antonio, I think, where we see a significant proportion of older people in our community that are taking care of their own grandkids, or their grandkids are living with them. And there's been a group here that has organized themselves around those particular issues, the needs that they have, and they have pressed for better public policy and so forth. And this has been Latina women that have been very instrumental in making those very positive changes. And that again has to do with, again, the organizing as people coming together and trying to better their conditions, and then how you work the policy system in terms of making sure that you get the representation and making sure that you're pushing your agenda with the political leaders, people who represent us here locally, and so forth.
Growing up, my mom had me talk to the social service provider, the telephone company, the landlord, utilities, because my accent was much better than hers, to sort of like represent that and to learn to advocate for these issues. So I think, I mean, and that's just kind of the privilege of growing up at that point with, my mom was a single mom at that point, and the privilege of learning how to advocate for your mom. And I think part of it is getting men to start organizing and advocating for social services. Que no tengan pena, get over yourself, like, you know, eat, do what you can to make sure you get food on the table. And it's just as much advocating for the family to go knocking on doors to cut someone's lawn as it is to call the school service to get PEBT for your family. It's sort of like getting over your sort of like a sense of what it means to help the family and what it means to be fuerte, firme, y formal. I mean, firme can mean a number of different things. I'm sorry, to stand firm and strong for your family in a formal way. It's really important that people learn to stand up for their family and the people they love in a number of different ways.
Okay, one of my colleagues put this question, it wasn't me, I swear, but it's a good question for us at the Mexican American Civil Rights Institute. The question is, what kind of public history exhibit can you imagine at a place like the Mexican American Civil Rights Institute that would look at the public health history of the Mexican American community? What would be like the key points, the key topics of such an exhibit?
Okay.
Oh, I'm sorry.
I'll go
Rogelio,
and then I'll let Dr. Sáenz give a much better answer first.
Okay.
You're the expert in this area, John.
Okay, so well, first what I would say is I would ask people to sort of like come down, to write down their definitions of what they think healthy is, and what they think democracy is, and what they think citizenship is. And of course, there's going to be a number of expected answers. Me siento bien cuando estoy en familia. Me siento bien cuando no me siento amenazado. Me siento bien cuando me va bien. Sort of like getting those sorts of situations and those answers, and then finding people who've organized around those issues in terms of health. There's a great Texas public health report that I can share that does the map of Hispanic health inequalities and outcomes for the state of Texas, and then sort of like concentrates in San Antonio. So I would, given what I know about Austin and every place I've worked in, people think about their lives in neighborhoods, and people think that the neighborhoods that they're experiencing are the neighborhoods that have always been there. So finding ways to point out people in these places when they're organizing around questions of social justice and pointing out that it was also health. I would ask Dr. Martinez-Rogers to talk about the different nurses that she knows that have been involved in community movements and social organizations, and have them talk about those issues, and then have people who were in those community organizations also record stories about their issues. And then to get people to think about, like, what would it mean to feel good at work? What would it mean to feel good in your home? And to sort of like organize it around sort of like community understandings, and then branch it out to health.
I love that.
And I would just add, in terms of identifying historically some of the major figures that were doctors, nurses in our communities that contributed so much, because what MACRI is, that we're hoping and that we're very proud that this is off the ground, is that the neglect of our history is going to be corrected here with MACRI, and those physicians, doctors who treated patients that couldn't afford to pay and so forth, and the wonderful support that they provided to their communities, the nurses, healthcare workers, and so forth, recognizing that rich history that here is in San Antonio, and highlighting that and serving as role models to younger kids, and making the connection of that John mentioned in terms of the disparities that exist in neighborhoods, in terms of the lack of access that continue to exist to healthcare and access.
And there's, well, actually two more. This is, I mean, I could talk about this for hours, but there's also getting people to sort of like look at their neighborhood. There's a wonderful faculty member, geography department, who's done citing of all the legal and illegal toxic waste dumps along the I-35 corridor. So having some people be able to do a little GIS sort of like thing, oh, what's going on in my neighborhood, and have the map pop up. That's really good. But also, I talked about health as an ideology, but I think the other thing that Dr. Sáenz pointed out is that health is also an institution. And then just thinking about the ways that the institutions of health both included and didn't include people, Latinos, Mexican Americans, and other people in San Antonio.
Well, we have managed to go just a couple of minutes over our hour and a half, but it was just a wonderful conversation. I want to thank all of our panelists. I want to thank Palo Alto. I want to thank the city of San Antonio, Bexar County, and all of the folks who watched tonight and sent in questions. I think that public health is something that is going to continue to be a theme of conversations that we host. And so this will not be the last conversation. There's many other areas that we need to tackle, and we need to advocate for change for our community. So I want to thank both of you. I know Dr. Martinez-Rogers had to step away to another meeting, but thank you, Dr. Mckiernan-González and Dr. Sáenz. It was wonderful to be with you tonight.
Thank you very much.
Thank you. Privileged to have a forum. Thank you so much.
Yep.